Here's my audience of 5. Good evening, everyone. My name is Speech-Beasley, and I'm here to inform y'all about eating disorders. I'm sure everyone here has heard about eating disorders, but do you really know about them? Eating disorders affect several of Americans each year. In fact, according to the National Eating Disorders Association, a shocking 20 million women and 10 million men suffer from eating disorders at some time in their life. When most people hear the words eating disorder, they probably get the image of a teenage girl starving herself. But eating disorders affect many different age groups and come in 3 different main types: anorexia, bulimia, and binge eating disorder. After this speech, you will know 3 main things. The 3 main types of eating disorders, how serious they are, and ways to prevent and treat them. The first disorder I'm going to talk about is anorexia. Surprisingly, this disease or disorder is largely psychological. People who suffer from this disorder have inadequate food intake leading to a weight that is clearly too low, such as the girl in the picture, a psychological fear of weight gain, and an obsession with their weight. And their self-esteem is also largely related to their body weight. Some facts about anorexia are 90 to 95% of sufferers are girls and women, and between 5 to 20% of individuals struggling with anorexia will die. They also have one of the highest death rates of any mental health condition. Along with this disorder comes some serious health consequences. The body is denied the essential nutrients it needs to function normally, so it is forced to slow down all of its processes to conserve energy. This slowing down can have some serious health consequences. They are an abnormal slow heart rate and low blood pressure, which is actually the heart muscle changing, a reduction in bone density, which leads to dry, brittle bones, and severe dehydration, which leads to kidney failure. And also there's another thing it does, which I didn't know about. Most people with anorexia grow a layer of hair called languor, which is the body trying to make itself warm. It's trying to make an effort to keep itself warm, such as the child in the picture. The next disorder I'm going to talk about is binge disorder. It's different from anorexia and bulimia because with this disorder, people would take too much food instead of not enough. People with this disorder consume large amounts of food and do nothing to prevent weight gain, such as vomiting or laxatives. They also eat when not hungry and eat to the point of discomfort. And also when they're eating, they're shameful about their eating, so they eat in their privacy of their homes or the privacy of their own rooms, not in front of anyone. Health consequences of binge are commonly associated with those of clinical obesity, which include heart disease, diabetes, gallbladder disease, high blood pressure, and high cholesterol. Some serious facts about binge are: it affects 1 to 5% of the entire world population, affects slightly more female than males, which is 60% female and 40% male, and also people with binge can be of normal weight, which I thought they had to be obese, but they don't. And this disorder is largely associated with depression. The third and final eating disorder I'm going to talk about is bulimia nervosa. Similar to binge, except they do take measures to prevent weight gain, such as vomiting or laxatives, which are they partake in purging behaviors, which are frequent trips to the bathroom to gag themselves. They have excessive rigid exercise regimens because they are obsessed with their weight. Also, they have swelling of the cheeks and jaws from too much vomiting, and also have discolored and stained teeth, which is also related to the vomiting. There are also some health concerns associated with bulimia. The recurrent binge and purge cycles can damage the entire digestive system and major organs in the body. They are dehydration, which leads to electrolyte imbalance, which leads to irregular heartbeats and heart disease, and inflamed esophagus from too much vomiting, tooth decay, which I already explained, and irregular bowels due to the laxatives these patients may take. Also, here are some facts about bulimia. 80% of the sufferers are female, and then they can be of average body weight. And 1 to 2% of all y'all young adult women suffer from bulimia. In conclusion, here are some ways to acknowledge, prevent, and treat these severe disorders. The first, most important one, are psychotherapy and psychological counseling, because these disorders are mainly psychological. The next is to pay close attention to their medical and nutritional needs, which may mean they need to see a physician or a dietitian. And also, lastly, they need to develop a positive body image, because if they didn't have a positive body image, then why would they do this? And if they did have a positive body image, then why would they do this? So I'm going to leave y'all with this picture right here. It shows women of all different shapes and sizes, and this doesn't always just pertain to women. And it says, beauty comes in every shape and size.